see this little exclamation point there. The other thing I wanted to show you all in Blackboard so you know, for this class certainly, and frankly for your other classes, you have the capacity in Blackboard to send emails. Don't do that, right? I'm not going to pull them up, but it's useful. But one of the things I was going to say is don't, when you go to use this, let's say you have to email Dr. Reitmeyer, so you go to find her email address, because it'll be in this class.
And I'll send you emails.
Right, you can email her. But if you send any emails through Blackboard, make sure there's a little box before you send it that says send a copy to the sender, to yourself. Check that box so that the email comes to your US email as well. Blackboard does not retain emails. So any email you send through Blackboard, it's nice, it got sent, but you've got no record of it.
Somebody had a question down here that I just want to announce to everybody because I think you all may have a question about this. And that is, if you work with a preceptor more regularly than the field instructor, I would encourage you to have the preceptor sign it in addition to the MSW field instructor. The field instructor is the one that has to sign it, but if the preceptor is the one that's knowledgeable about your hours, you can download these and add in another column if you want to, one for preceptor signature and one for field instructor.
No, that's why it's a printed out hard copy document that you filled out, you signed it, and your field instructor, possibly your preceptor also that signed it, hard copy. And then you would scan it through any number of resources evidently, so that you have it as a PDF or Word document that you can then upload into Blackboard. And that also allows you to keep the original, for your records, just with the liaison in case something happens, that kind of stuff. The site, we are in the process of creating a field website for students. It is not ready yet, so there's not really something to show you on it. So you'll receive notification from Dr. Reitmeyer, field office, and that'll be a website that's actually, it'll help to disseminate, a word samples, templates, and announcements for everybody, and those kinds of
Same
things.
stuff you have on Blackboard,
Right.
but just one place to go.
Exactly. Whether or not, much else in this section, is there a question?
Are we to add in today's tomorrow's hours?
Yes.
And so how many people are write in?
How much ever content we require, you obviously would not get count. Somebody asked me about miles traveling, that time doesn't count, lunch doesn't count. Just, it would be equivalent to if you were going to do a CEU, the time equivalent to content.
Yes, it's the time you're here, not the time you have lunch.
So I'd say that for today, it's equivalent to, depending on when we end, it could be worth 6 or 7 hours. I think it's probably more like 7 hours.
And tomorrow is similar, unless you're happen to be one of those people leaving at 3 o'clock. You got 5 hours instead.
You don't need to, because I know you were here, and I'll have the master list of who signed in. Also, since I know who's left, so I'll be able to account for it.
I was talking to somebody that is in their second year at field placement, and they said their liaison goes more by days than hours.
That was last year.
That's been intense.
That has been changed to the program as a whole.
Oh, so it wasn't.
I mean, that wasn't accurate.
past.
That was accurate last year. It used to be like 33 days in the first semester, 35
okay.
days in the second. That's just been completely changed. It's all
It's just
hours.
been calculated by hours. You gotta hold everybody with the same standard. So I can't say, hey, you're in a 7.5 agency, so you have to do less hours than somebody in an 8-hour agency. So we really need to make that more equivalent. So now it's a certain number of hours everybody has to do, and it's based on 7.5-hour day.
So, because I know that in there it's at 15 or 16-hour days. Are you assuming that our days, or our week is going to be a 15-hour week or a 16-hour week?
I would encourage you to make it a 15-hour week. I understand an agency maybe 8 hours, but I think I would just say I'll be here 7.5 hours each day.
To make sure
I think
that
that's fine. I don't think they're gonna get too upset about an extra 30 minutes, but that is something to work out with your field instructor. And they're aware of this because they got the same training as well. If for some reason they weren't at the field instructor training, just tell them to call me.
Well, and also the way the semester essentially spaces out,
Yeah.
with odd weeks that fall where they are. You do a 15-hour week each week. When you get to the end of the semester, December and May, you're at that hour total that
Right.
in each week.
I think
some faculty that may be stopping by that weren't able to meet. I know some of you weren't here Monday, Tuesday, but we do have some faculty who may be stopping by to just introduce themselves that were not able to make it on Monday or Tuesday. So if somebody does come in and I stop, that's probably what it's for. I can't remember if some of them are coming by today or tomorrow. Let me find where we are with this. If you want, we have a lot of policies around well-being and feel. Has anybody, did they talk to you about this at all? Okay, I'm not sure how to take that yes. Let me ask you this, what did y'all learn? How to what? Oh, who talked about that? Okay. So he talked to y'all a good bit then about self-care, I take it? And what not to do. So what I'm gonna do to save us time, because we've got a lot of other things we need to go over, I am going to focus on the emotion regulation part. All right, so y'all learned about what use of self is. You talked about use of self and how it relates to self-care? Yes, no? You know what use of self? Use of self, is just really the self-awareness you have about how you impact others, right? Your values, your thoughts, your beliefs. Here's one of many definitions. It's combining you, your individual, your knapsack, your history, all right, with aspects of your personal self and how you practice with clients. It's really about how you use yourself in your interactions at work, with clients. How many of you in here think that you're really good at being able to separate out your personal self from that professional self? Raise your hand high. That's probably, it's a struggle. I still struggle with it. We're always evolving. It is what we constantly have to work towards as social workers, I think. And it's easier said than done because our personal values don't always reflect how we are supposed to represent and engage professionally, correct? There is a lot, the reason how do you think, how did it do that again? It doesn't like me walking around. Or maybe it's to get your attention because we're after lunch and it's the Sparkle Shack, right? All right, so how do you think use of self is related to self-care? Rob talked about it. How good are you at self-care if you don't have a developed use of self? Not good. Use of self really is a foundation, and I'm talking about a concept that you're going to learn and talk about a lot more when you get into your coursework, but it really should be introduced in orientation because we can't really engage and know how to take care of ourselves without understanding that premise, that separation, or our ability to recognize when our personal stuff may be impacting our professional self and use of it. All right, I put in your packet, has anybody found it, a self-care assessment? It's in the very back. And I'm not going to if we had time, I was going to have you do an exercise around it. But I encourage you to look at that assessment and to take it during block week when you have downtime. If you do, I want you to look through that and I want you to take an accurate assessment of yourself. All right? Because the thing, and this is just a few of them, which kind of mirror some of that, these are things that impact our ability to take care of ourselves. And I know this for a fact. I call this the container. I use a lot of DBT, and you're going to get a lot of dialectical behavior therapy skill set because I did it for so long throughout the day today and tomorrow. Because I think it's not only good for work with clients, I think it's good for everyone to learn some of these basic concepts. Sleep. If you don't get enough of it, how do you change as a person? Regular exercise. How are you able to function if you don't get regular exercise in terms of stress? Not taking medications as prescribed that you're supposed to. I'll tell y'all a secret about me. Maybe I shouldn't disclose this. I have to wear a mouth guard sometimes because I grind my teeth. If I didn't do that, that probably wouldn't be good, right, health-wise. And I feel it, it creates pain. I got what you call, everybody has TMJ, but it becomes tense, that muscle does. So there are different things, whether it's medication, a mouth guard, whatever. You need to do what you're supposed to in order to put you in prime condition to engage in life. But as a social worker, you need to be in prime condition to engage with folks you're supposed to be empowering, right? So there's almost a higher level of standard for you in terms of your ability to take care of yourself, or at least that's how our professions views it. Diet and nutrition. How many of you know if you had one too many Red Bulls, coffee, maybe you don't want to drink it all day long, but maybe it's not such a good thing. We've had situations of placement where students have engaged in behaviors that have resulted in conferences because they are taking too much caffeine or they're not getting enough sleep. They're falling asleep in treatment team meeting. They are, too jittery. They can tell that they're crashing and burning because they're having a hard time self-regulating their self-care. Drug use, abuse, prescription. The new rage is taking Adderall so that you can study and stay awake. That kind of stuff's obviously forbidden. We have situations that we have to attend to during the school year when there is a suspect that there might be someone struggling with how to cope in a healthy way with all the demands and stress of graduate education. So if you're feeling a stress or pressure in that direction, I'm going to offer you some resources in a bit. Also, if you need to be in ongoing therapy or support groups, I would encourage you to do that. There's nothing wrong with that. You've got to learn how to help yourself before you can effectively help other people, right? And the University of South Carolina recognizes that. We actually offer, through our counseling center, you get, 12 free counseling sessions. They also have groups that you can participate in, support groups that help you with anxiety, sleep management, anger management, you name it. There's a whole list on the website. Did y'all talk about that in the last 2 days? Oh, good. The most important thing that y'all are going to look at me and say, what are you talking about? You really need to find some me time. And I put this on here because that is it might be more important. Have y'all ever learned the technique of, if you're engaged in worry, thought, anxiety, about how to put it on the shelf? And you tell yourself, you know what, I'm not going to worry about this right now. I'm going to worry about it from 5 to 6 tonight. And I'm going to go and I'm going to enjoy this movie and I'm not going to think about anything. You need to find a way to unwind, de-stress, let go of worry thoughts, find time for you to enjoy and participate in life. Because if you allow yourself some time to enjoy and participate in life, you're probably going to be more able to participate and engage in your graduate education. Why do you think I'm making such a big deal about it? How do you think this plays out in the field? If you can't take care of yourself, which I don't mean that as a judgment, that did sound kind of judgy, didn't it? I mean it more like if you're struggling with that. Because sometimes we want to be able to do it all. We want to manage the classes. We want to manage field. We want to manage if we work, if we have children, if we have a parent, a grandmother that we take care of. We just want to get through it. But what I'm saying is there might come a time where you have to say to yourself, I might need to take a break. Whether that break is a couple of weeks off from field, that is an option, okay? Now, I'm having this frank, candid conversation with you for a reason. We have policies around it, which I'm going to talk about in a minute, but you do not have to do it all and be everything to everybody. I've had students come up to me and say, I didn't think that this was going to apply to me, but it did. They had a mom that would get cancer, or a family member that gets sick, or maybe they get sick. Or maybe they don't realize what brought them into social work until they get into their field practicum and they start getting triggered by the clients that they're working with. And so they start to realize they have things to work through. Some of you sitting in this very room, I'd say about 20%, may experience issues around how to manage your well-being. And it is totally okay if you need to take a break for a while. And when I say take a break, that's not a weakness. That means you're recognizing that, apparently I'm not recognizing the cords on the floor, but you are at least recognizing that you might need to do a reassessment of your situation. And maybe you just focus on classes for 4 weeks, and you talk with your field instructor about taking a break for 4 weeks, and you can make up those 4 weeks at the end of the semester. Are you following me? Because I can give you an NR, and no report comes off of your report. You know how Jennifer talked about NRs and Is? I usually don't give it incomplete if it's less than 40 hours. Because I recognize people have life circumstances that happen. We all do. I definitely have had my share of life circumstances when I went through the MSW program as well as the PhD. So I understand about a need for that flexibility. This is my saying to you, is that you're sitting there thinking, this isn't going to happen to me, I can handle it, and I'm letting you know that if it does, that there are other options that we can explore. How many of you in here know how to identify your emotional experience? This might help you. I'm going to give you a skill. We're going to talk about emotion regulation for a minute. How many of you in here know how to identify your emotional experience? How many of you know when you're happy? Raise your hand. What tells you you're happy? Smiling. How do you feel on the inside? You feel good? What do you want to do when you're happy? You want to do everything. Do you want to hit? Do you want to embrace? Do you want to run? Do you want to hide? Yes? You want to do it all? Huh? You usually want to embrace if you're happy. If you're sad, do you want to be around people? No, you want to withdraw. If you're angry, what do you want to do? You want to hit, or you want to say that you want to attack. Okay? Here's a fun little exercise we're going to do. I don't want to take too long on it because I'm trying to be conscientious of the time. But here's a great little DBT chart. This is a dialectical behavior chart. And I always used to call it the birth of the emotion when I would teach my clients and parents about this. And that is, ooh. All right. I think I need to stand over here. Or maybe not. Apparently. Okay, it takes a while. It's process of an emotion at the top. And if you notice at the top line that talks about interpretation, you're going to have things that happen in placement. One of the things that I've been paying a lot of attention to today has been your nonverbal expressions. How many of you in here, talk about use of self, how many of you in here are aware of the expressions you make when you're feeling a certain way or experiencing a certain emotion? I would encourage each of you in here to take on as a possible task an opportunity, if you have the time, to record, get to know a little bit about what your nonverbals are, because some of you have communicated to me that you're bored out of your mind, you fall asleep, I've seen some eye rolls, different types of things. Okay, this kind of exercise and run through the chart will help a bit with that. You're going to have things that happen, whether it's something I say, you're going to have a stimulus in the environment, whether it's something you're thinking about, could be a smell you come into contact with. Do some of you smell things that remind you of someone? Okay, if it's associated with bad things, what's going to happen is you have a prompting event below where it says interpretation. When a prompting event happens, it says number 1, you interpret it in your mind to mean something, right? And that's usually what elicits an emotional experience, however it is that you interpret that. And then you go through some internal changes. Remember I talked about action urges earlier? And I said, what do you want to do when you're angry? You said you want to attack. If if you're experiencing joy, you usually want to embrace. If you're sad, you usually want to run and hide. And then you have an action, something that you actually engage in. The big lesson that I like to give folks is your action urge does not have to match your action. And part of use of self and paying attention to yourself is figuring out where you're going to fall in those two things. And apparently we're going to get a thunderstorm. Apparently, sometimes your action urge should match your action, but most times it shouldn't. And this is what you're going to start to learn at home when you're in social work and you're in the field setting. All right, it has an emotion name. So, I'm going to give you a general example. Just a common example, a fun example. I try to think of a fun example because it would be after lunch we'd be doing this. Imagine you've been in the program all day, you've taken your classes, all right? Maybe you're doing a nighttime field placement where you're working from 4 to 8, and your field supervisor tells you they're going to be out of town, and you're going to get to have the next week off, you've worked some hours ahead, and you're trying to go home and make plans. So you go home and you ask your partner, and you say, I'm going to have Tuesday free. would you like to do something? I was thinking we could go somewhere and do something relaxing. And he says, or she, I'm sorry, I've got plans that day. But you think, okay, that's cool. I'm going to ask my best friend. So you call your best friend, you say, hey, I've got this time free. I want some me time. Let's get together. Let's hang out. And he or she says, you know what? I have got plans that day. I cannot do something. So you're like, fine. You know what? This will really be me time. I'm going to go do some retail therapy. I'm going to go get a pedicure. I'm going to go get a manicure. I'm going to do whatever. So you go, and then you decide you're going to walk down to the mall. You go walking through the food court, and who do you see sitting over at a table? Your partner and your best friend. Okay? Now, what would be the prompting event? Huh? Yes. Okay, up here in the front. Prompting events is seeing them together. Now, how do you interpret that? A lot of you had an immediate interpretation, didn't you? Now, would that necessarily be an accurate interpretation? Okay, we got someone at the front saying they can be. Maybe your birthday's 2 weeks away. All right. So you could be thinking, oh my gosh, they're doing this. But the point and the reason that I'm bringing this to you is the importance of sharing this with you is this is a mechanism to help you slow down that process of interpreting that somebody's having judgments about your confidence and field placement. When something happens and you read someone's expression, be careful about how you're interpreting things that you see and you experience and feel, because it may not at all be what you think that it is. Because then that begins a whole process of how you're going to engage in that experience. If you really did go and you didn't have as much exercise and holding back from engaging in your action urge, and you did think something was done against you, you could go in and damage two very important relationships, right? The same can be true with your field instructor, your field liaison, your organization. You really want to peel it back. Take some time to really think through before going with your impulse, okay? And really think about that. So just think about that, and I think that can be helpful. I also think that if you are starting to have some feelings or your interpretation of what your experience is seems to consistently come up on a negative side, you need to have some direct conversations with your field instructor, right? About what's going on. Is what I'm thinking accurate? You know how we talked about seeking clarification earlier? Seeking clarification and building that rapport with your field instructor is exceptionally important. Because if you are experiencing struggles and you want to take a break like we talked about, the first person that you might want to talk to is your field instructor, but also you're going to have a faculty advisor. Our faculty here are wonderful, and they really want to be here to help you develop as a professional social worker. So you have people you can go to and talk to about this stuff. You also have your field liaison, which you're going to get an assignment for in the next week or two. They also have the support groups I talked about earlier with the counseling center. How many of you in here have already developed relationships with one another? You have each other. I know some of you bonded over lunch, you talked about things. You have each other. You have family. You might have helpful friends. And family doesn't necessarily mean biological. It could be your family you have here. It's whatever family you have. And then the counselor and the counseling services. All right, and I have this on the slide, but it's also in your book. What page is that? Page 51 is where we're going to turn to now. And this is the yucky stuff that I like to talk about self-care, and I know that you all can take responsibility for this, but sometimes what happens is students find themselves in a situation of denial. And what happens is the field instructor or the preceptor notices that there are things going on and they're having problems with the student's performance as it relates to how they're engaging or whether they're engaging or not. Maybe they stop showing up for field. Maybe they seem to get into elevated, frustrated conversations. Really some eye rolling. lack of engaging in professional behaviors. Usually we start, the worst comes out in August when we feel stressed and we don't take care of ourselves, right? So I don't think it's that any of you that may experience this, if you do, are bad social workers or bad students. I think it's about self-care. You've just not, been able to kind of maintain yourself in a way that puts you in the best light. So we kind of talk about that. You have stressors, things happen. If it gets to a point where it's problematic, the field instructor is supposed to meet with you and come up with a plan for improvement. And at that point, we usually, talk about, do we need to take a break from field? What do we need to do? In some instances, it may be that they don't want you at placement anymore. Sometimes in a moment, if we haven't been able to be engaged in that action urge, a lot of times that can be a result of immediate removal from field. If you say, call someone a profanity, we've had the range of situations, and I don't know if Jennifer wants to, I don't really want to offer anything real specific because I think about HIPAA and I think about FERPA, but there have been the range of situations that we've had occur all the way from suspected drug use to inconsistency over just not showing up on time. Seems to be something chronic. People want to be supportive of your life situations, but if you're always late every day, they can't depend on you, and that becomes an issue. They're thinking maybe this isn't the right time for you to be able to engage in field. So when that happens, depending on how egregious the situation is, I always do a full review. If you get terminated or there's suspicion or something from field, I have to get involved. Your field liaison will manage it on a superficial level in terms of is it just tardiness, is it that you're not performing where you need to be, then we'll help you, we'll give you support, you're learning, we know that you need assistance. But if it becomes real serious professional behavior issues, I get immediately involved and I make a determination about whether I just need to have you take a break from field, period. And that does happen. And because it has become a growing concern, and especially from our field community, we actually, if it's at a certain level, we have students go through a full review on what's called the Student Retention Committee. And I don't want that to scare you or make you afraid, but I think it makes sense that our first ethical responsibility is to the clients we serve, right? And if you are not in a situation where you're able to be mindful and realize you need to take a break, then we have to help you take that break. And I'm not going to want you back in field, and neither is the dean or other people who hold a social work degree as well, until we know you're ready to completely engage with clients. So I know y'all, it's dead silence over the crowd, but it happens. So my big encouragement is for you to be proactive about your self-care. When you notice that maybe things are on a slippery slope and you might need someone to talk to about time management or stress management, let's get the conversation started early so we don't get to the point where I have to be in a situation to hold you accountable, or your field instructor. That's never a fun thing to do, but we have to do it. Because sometimes it's difficult for us to recognize when we need help ourselves. Does anybody have any questions about self-care, about emotion regulation, about these policies? All right, with that being said, I'm going to turn it over to Jennifer so she can finish the conversation about what to do with safety in social work settings. Stretch it out, everybody real high. Deep breath in. Let it out. Stretch it out. How's that feel? Better. Feel good? I want everybody awake and actively engaged in our conversation about safety. All right, who's ready? Woo! Let's do it. Let's
about safety and field placement. Okay? Cliff, who you guys met this morning, told us that we are responsible for advising you, legally, that there's risks. There's inherent risks in field placement. In any field setting, that there is the possibility of something happening to you in the field. Okay? So what we're going to talk about today is some precautionary preparedness. How many of you guys watch the Weather Channel? How many of you guys seen that ticker on the bottom? It's like, if you live here, take precautionary preparedness. Every time I see that, I think I should get in the washing machine or the dryer. But it gets my attention. So I'm really liking this phrase now, precautionary preparedness. Feels proactive. Feels like you're doing something. Feels like you're taking control. Okay, so basically, we're just going to talk about some guidelines to keep you safe in the field. Okay, so this is what I'm going to cover. You don't need to read it out loud. All right, most important thing, and I hinted at this earlier, is when you guys get in the field next week for block week, you need to ask these safety questions. A lot of you guys are going to be in locked facilities, right? So you want to ask, if somebody comes to the door and says, they're so-and-so's mom, so-and-so's brother, do I just let them on the unit? How do I know who to let on the unit? If I'm on the unit, how do I know somebody's not supposed to be on that unit, right? These are all things you need to understand. What is their policy for working with high-risk clients? Are there specific procedures or protocols? Are there specific procedures and protocols about building security and building safety? Okay? How many of you guys have heard of bloodborne pathogens? Anybody in here not ever heard that word? Has not ever heard that word? Okay. So basically what bloodborne pathogens means is, exposure to bloodborne pathogens through blood or bodily fluids. Okay? Now a lot of you guys in here are going to zone out, drown me out for the next 5 minutes and go, I'm not in a hospital. Right? I'm not near needles. But guess what, guys? You can come into contact with blood and bodily fluids anywhere. Anywhere. I could wipe out right now, knock my head out on that table, and bleed all over the floor. Okay? You guys could be at a mental health center. You could have a patient who has a seizure in the lobby. Right? You could be at DSS, and you could have somebody have a medical emergency in the waiting room. Okay? So I really want you guys to pay attention to this because there are specific procedures. Okay? Obviously, number one, no-brainer, don't touch blood without gloves, right? You know what I do? I always, whenever I go to the doctor's office, wait, are they filming this? Yeah. But whenever I go to the doctor's office, I always steal a couple gloves while I'm waiting for the doctor to come in and the nurse leaves. Stick them in my pocketbook. I paid for it. It's my copay. I'll admit it, it's on tape. You know what I do? I always have some in my work bag. I do. I freak her out. I'm a germaphobe. But I have them in my car. Because guess what? If I'm driving down the road and there's an accident and I want to assist somebody, I want to be able to assist them in a way that's safe for me. So I'm one of those people, I always like to have gloves around. You never know what's going to happen. You never know. Okay? So these are kind of things like, oh, I'm at a school. Okay, kids do crazy stuff. Who has kids? Who has kids that do crazy stuff? You know what I'm talking about. Okay? Have gloves, guys. We actually have an online training module for you. Some of your field organizations require that you do it, some of them don't. But if anybody wants to take the training module, just to test their knowledge, test their, can I pass the test? We can give you the information to log on online. I would encourage everybody to do it. But these are all questions you need to also ask at your field organization, because they probably have all sorts of OSHA stuff, and with that MDMA, the CARB accreditation, they probably have policies about it too. Okay, question?
I was just gonna ask if the university offered anything as far as like CPR, first aid. Okay.
There are classes that you can take within the university. I know the American Red Cross offers CPR classes. Columbia is a pretty big metropolitan area. There's lots of community churches, lots of places offer CPR classes if that's something you are interested in. Yes.
I actually work at Strom. I'm a lifeguard there, and so if you're interested, I actually just got certified to teach this class. So you can contact like the aquatic supervisor, and they're like the ones that do the most like CPR classes and stuff like that. So they have a lot of bloodborne pathogens because all the lifeguards are like everything certified. So if you're interested, you can definitely contact them.
CPR will save a life. All right, anybody questions about bloodborne pathogens? I know, it's really exciting. We've covered this. Wear gloves, wear gloves, wear gloves. All right, if you guys have an exposure incident, I know that sounds a little CDC, scary, but that's what they like to call it. Anybody here has an exposure incident, you're supposed to immediately contact your field instructor. You're supposed to rinse with water and soap the area that you did have the exposure. Well, yeah. If you're standing with your field instructor, you would tell the person then, obviously, cleanse the area. I'm supposed to be this serious face, I'm trying. And then obviously you're supposed to seek medical treatment as soon as possible after the incident. If you guys are here in Columbia, during normal working hours, you guys would go to the Richland Family Practice, and the information's here, and I think it's also in the field manual as well.